Hello and welcome to today's program. I am Ogechukwu Ukekwe. The National Agency for Food and Drug Administration and Control (NAFDAC) has issued a warning regarding the recall of a specific batch of Nivea Black and White Invisible Roll-On deodorant. This deodorant, which claims to provide 48-hour protection in African climates, is being recalled due to safety concerns. The affected batch number 935299610 contains a chemical which is prohibited in cosmetics because it may harm the reproductive system, pose risks to unborn babies, and causes skin irritation or burns. NAFDAC released this notice following a warning from the European Union Rapid Alert System for Dangerous Non-Food Products. The agency urged importers, distributors, retailers, and consumers to exercise caution and vigilance within the supply chain to prevent the importation, distribution, sales, and use of the affected Nivea roll-on with the specific badge number. The Katsina State government says it is collaborating with the Society for Family Health to improve sexual reproductive health outcome across its 34 local government area. The Executive Secretary, Katsina State Primary Healthcare Development Agency, Samsudan Yahaya, disclosed this at a three-day state training of trainers. According to reports, the training was on empathy-based counseling and counseling for choice in Katsina, aimed to enhance healthcare in the state. Represented by the Director of Primary Healthcare, Kabir Abba, Yahaya said the collaboration was through the Delivering Innovation in Self-Care 2.0 projects. According to him, SFH, in collaboration with the state government, has launched the Delivering Innovation in Self-Care 2.0 project across all 34 local government areas in the state. Let's take a break. The program will return shortly.
In the last 3 years, we have built a multi-purpose center, which is the envy of all in our constituency. And I can tell you that the people who are living there are already enjoying it.
Guy, do you think what this man just said is true? See, I seriously doubt. I'm sure it's one of those their silly lies.
Wait, do you know there's a way to find out if these things he's saying is true or not? This is the Construct app. It gives people like us a sure way to track implementation of constituency projects. It gives valid and verified information on location of projects, amounts allocated, amount funded, the level of job done, and even the profiles of concerned legislators. You and I can post directly on this app.
Are you serious?
This is the Go-To app if you want to know how our Commonwealth is being expanded by the government.
Wow. Let's even see if what this man said is true. Show me.
The Construct app is developed by Other People Nigeria with support from USAID and is available on both Google Play Store and Apple Store.
And it's true.
Of course, I told you.
Corruption not in my country.
Hello, Alahaji. Right now I'm in Abuja. No. Hello, Adamu. Right now I'm in Kano. Yes. When I get back, I will just call you. Look, what is wrong with you? I'm talking on the phone and you are gesticulating and doing. What's wrong with you?
Daddy, where exactly are we as we speak?
Are you alright? This is Lagos.
Well, you just lied to someone that we're in Abuja.
Keep quiet. Who told you you can tell an elderly person is lying?
Daddy, you just lied. And by lying, you're raising corrupt children for the future of Nigeria. That is corruption, not in my country.
Corruption not in my country.
Welcome back. The World Health Organization has urged the Nigerian authorities to leverage artificial intelligence (AI) in disease surveillance. Speaking at the opening of the 5th Annual Disease Surveillance Review meeting organized by the Nigerian Center for Disease Control and Prevention (NCDC), WHO country representative for Nigeria, Walter Molumba, said the need for AI integration in pandemic preparedness and response. According to Molumba, Nigeria can enhance its ability to detect, prevent, and respond to public health emergencies by adopting AI in its disease surveillance. He explained that the aim of AI integration is to contribute to the reduction of morbidity, mortality, disability, and socioeconomic disruption due to disease outbreaks and other health emergencies in the WHO African region. Well, joining me on the program to discuss further is Dr. Tuyi Mebawondo, a public health practitioner. Thank you for joining me on the program, Doctor. So the World Health Organization has called on Nigerian authorities to harness artificial intelligence, that's AI, for enhancing disease surveillance. What are your thoughts on this?
Well, thank you. If we're talking about disease surveillance, we're talking about the system of collection, analysis, and dissemination of data and leading to actions as regarding disease. Basically, we have the collection of data, we have the analysis, we have dissemination, which will drive us to take action or respond to whatever we're collecting. And if you look at the traditional system of data collection in health, it means that I have to fill what we call the vital records. Vital records means that at a point in an hospital, people are filling in number of this disease, and then those things are then submitted physically to the primary health care or even health epidemiology people in the Ministry of Health, who will then analyze the data and bring out reports and decide the actions to be taken. Also, if you look at the traditional system of data, if I suddenly in an hospital or witness a rise in particular number of cases, let's say cholera, or people coughing repeatedly, I have to also report that. That is actually a traditional method of data collection in disease surveillance. But what artificial intelligence will do is to gather all this data real time. You can imagine me collecting all the data from different sources, input it into a computer that goes to a central place, and other people from all other places collecting their own data and putting it into computer systems, or even data from electronic medical records, which are then disseminated to that center, and then after them to do predictions as a pattern of disease and be able to step out people before we see it, in such a way that once the conditions, some conditions are satisfied, it is easier for an artificial intelligence to be able to pick those abnormal conditions and sensitize us in that regard. So in a way, artificial intelligence is not going to replace all diseases. It's going to be a tool that will have a quick response and then prevent or mitigate the outcome of diseases. So it is the way to go, and it's the right thing to do, because not only in disease surveillance, we're seeing various applications of artificial intelligence in health, especially in diagnosis and in determining the appropriate kind of care or treatment.
In your opinion, do you think the adoption of AI will help in the reduction of morbidity, mortality, disabilities, and socio-economic disruption due to disease outbreaks and other health emergencies?
Gather the data. You need to analyze the data, disseminate the data before you get to the action. Now, there are different obstacles in doing this in the traditional way, which means that you have to fill papers, you have to rely on human beings to fill the papers, you have to rely on human beings to help in analysis, dissemination, and action. In any of these steps, AI can be deployed either in collection of data. When you use electronic medical record, you can fasten the collection of data, for instance, from the hospital or whatever, or from different disease outposts or surveillance outposts. Then the analysis becomes better when you have to use AI predictive analytical method to further enhance the understanding of your data, then before dissemination and before you take action. And you see this becomes very important. Either whether you are doing the traditional passive disease surveillance or you are doing active one, or if you are doing syndromic one, where you have some symptoms coming up abnormally and you need to find out why it's common. For instance, it may just be the sneezing that will be the beginning, that will be, for instance, that will point out the fact that there's an acute respiratory tract precaution going on. So with AI, it becomes easier to pick this data, look at it, and look at the clusters, disseminations. Is it happening in Kano? Is it happening in Lagos? Are we seeing it in Port Harcourt? Is it a national thing or localized thing? You know, the AI can quickly help in our response in that so that we can reduce the mobility mortality and of course in a preventive approach.
The adoption of AI in a major sector has resulted in massive job losses globally. Is there a possibility of that happening if AI is adopted in Nigerian healthcare system?
Well, first and foremost, we are not even having enough healthcare workers in our own environment. We need more of those health workers. Secondly, most of those health workers are overworked and they're overburdened. So we need to lighten their duties, for instance. So now in health system, we can actually do what we call reassignment of jobs and redesigning of jobs. In fact, what technology does most of the time is to create a new set of jobs around the invention. When there's any new invention, you create a new set of jobs around that invention. You can imagine the invention of automobile. What it means that you have to have people that are going to service those cars, for the beta and all those. So in reality, the fear of loss of job should not be a disincentive for anybody not to adopt AI, because we can actually restructure, rearrange workforce around health. And basically, we're not even having enough doctors, we're not having enough epidemiologists. And you remember I mentioned at the first time that it's going to be a good instrument for us since we're not even having sufficient epidemiologists in Nigeria.
As countries that are not yet technologically advanced like Nigeria, who are just beginning to adopt technology, what approach can be adopted to ensure that Nigeria that's at same level like other countries who are already using AI?
It's to start. The first approach is to start. You understand? We have institutions, we have teaching hospitals, we have universities, we have College of Medicine, we have computer science faculties, all over engineering faculties. The point is to start. You're not going to get anywhere if you don't start. Of course, the other thing is to push for collaboration. If you know centers maybe in India or China or Malaysia or even in the UK that are using AI sufficiently, we should be able to create a training mechanism where we have to relate across countries. And then we use them to train us. People we use our people to support them. In that way, adoption, once you start, you scale up. But the key thing is that your desire to start, you need to use your institutions, especially educational institutions like universities, faculties of computer, IT, and health sciences or College of Medicine. So we can't run away. It's not that we don't have the requisite intelligence to do it. It's just that we are not yet to do it. But more important is that government needs to provide those backbone, IT backbones that will help us work around this thing seamlessly.
So how can AI enhance the accuracy and speed of disease outbreak detection in Nigerian context?
If you look at our system in terms of its body, with the share of our laboratory, we have the same challenge. In public institutions, especially, we need to upscale the diagnostic capacity. both clinical, radiological, and laboratory diagnosis. You have to upscale all those things. Now, imaging, AI has been very useful in imaging, especially when you have a conflicting images that you cannot make sense of. It can be inputted into AI system where it will give you big clue that will help you do more. In addition, in laboratory investigation, AI can also be deployed to look at the possibility, why is this person having swelling of the leg, but the abdomen is normal. So AI, those kind of query can help you have a deeper understanding, especially in a place like this where you have a lot of people to deal with. So no doubt, AI is a good instrument in enhancing the accuracy. It's just like you are gathering all the intelligence of brains of 100,000 doctors to help you look into an aspect of diagnosis.
How can Nigerians ensure that implementation of AI in health respects ethical standards and patient privacy?
Now, one of the key things we've been discussing about electronic medical records is to ensure to prevent people stealing those records and, of course, falling into the wrong hands. At that level, you have to rely on your cyber security, the capacity of your country to be able to protect their data and prevent leak. And once a leak happens, you have to develop a way to quickly detect and block such things. And I can tell you, even in CIA headquarters or KGB headquarters, data do leak, information do leak. But what's happened is that they respond to it appropriately and block the leakage and then redesign their security system. So that is what we need to do. That's an area we need to look at. How do we assure cyber security, especially the health? Then transmission of every electronic medical data to across another place will be followed by serious encryption that will prevent either it falling to the wrong hand or even being stolen. So these are some of the areas, of course. That will fall within the purview of your IT team and engineering people to do that. I can, of course, we know that in this era, privacy with internet is getting lost gradually. But as far as medicine is concerned, the ultimate thing is that we don't want to disclose your illness to anybody without your consent. We don't want to expose you to any sort of stigmatization or ridicule because of whatever might be happening with you. That, in a way, is still possible.
And how can Nigeria foster collaboration between health authorities and technology companies to enhance AI capability?
It starts from that first interest, the government trying to see. Let's look at the Ministry of Digital Economy as your digital. I think there's a ministry like that. It can even really start from that point of looking at health tech innovators to design things that can help in disease surveillance, disease diagnosis, data analysis in health, and of course, dissemination and action to exercise. Now, you can start from that. The other thing is to look at a country that is already doing this and having sufficient progress, having some early wins, and collaborate with them. In that way, there will be an interface of both you and that country. The third thing is for government to look at our own institutions, like our universities, and stimulate such, stimulate by supporting research to see an interface, how to create interface between health and technology faculties with the aim of developing other software to look into disease surveillance. So it can occur at different levels, but the point is that you just have to start. start either, by pushing for a competition with the health tech, whatever health tech innovators. You train with other countries with some level of success, stimulate such conversation and research in your own university by putting some money there and looking for people that can create a platform, a committee that will look into that. So it has to be a dialogue, a continuous dialogue and improvement. AI in health or AI in anything, it's not one stop destination. It's a continuum that you keep improving given the challenges that might arise from such innovation.
Tuyi Wandu, a public health practitioner, thank you for lending your thoughts on the program. And that brings us to the end of today's program. Thank you for watching. I am Ogechukwu Okekwe. Bye for now.